Hi, I'm Nadja and I work for the NHS as a highly specialist speech and language therapist. Speech and language therapists usually specialise in work with either children or adults. With children, you'll often help them learn how to communicate, perhaps if they've been born with developmental speech and language difficulties. I work with adults who have neurological concerns that affect their speech and language or swallow function. Whether you work with children or adults, you're looking at how the brain helps or hinders your patient's communication or swallow function. In my current job, I see between 1 and 5 patients a day. I'm a so-called agile worker. So although I have an office space, I sometimes meet people online and sometimes in their own homes or in care homes. So I get to choose when and where I see my patients and how to fit it all together in my calendar. I'm part of a big team, including occupational therapists, physiotherapists and nurses. In my current role, I also supervise other therapists and talk to people from other London boroughs and teams to improve our service. So that means having quite a few meetings across the week. My favourite thing about my job is that it's often about solving a puzzle. If you solve it, you're helping someone to feel a lot happier than they were before. But the biggest reward of the job is seeing people relieved that they've been given support and seeing them start to feel better. One of the hardest things about my job currently is the pressure of working in a situation where about 1 in 4 speech and language therapy jobs aren't filled. It can be stressful knowing so many people are waiting on your support and deciding who to prioritise first. When I was about 7, I remember trying to teach other children who were struggling to read. Back then, the school wasn't very supportive of people who found reading difficult, and I wanted to help. At university, I actually did a music degree and then a year at the Royal Academy as a violinist. But when I realised I might not be able to be the best of the best, I wasn't sure if I wanted to carry on training, so I pursued teaching instead. Later in life, I moved to New York State and I got a student visa to train as a speech and language therapist and get my master's. After about 10 years working mainly in care homes and looking at swallow function in adults, I got a post in a hospital in the Catskill Mountains. But my role was so broad that I actually saw young children with specific speech and language difficulties. So I did get to work with children as I dreamed of doing. Doing well in school is not the be-all and end-all, I don't think. It's important to have an interest in caring for and communicating with others. I think it's really worth doing any care-focused volunteering if you can. If the medical side interests you, I'd say try and find opportunities to shadow therapists in a hospital setting.